It is day 23 of our 50 Days Pharmacology series where we look at different drugs and how they work. And we're moving on to drugs used for diabetes, what we call sugar in Jamaica and in other countries as well, so that you know this person has sugar. And we have to be specific when we say diabetes because there are two types of diabetes: diabetes mellitus and diabetes insipidus. Mellitus means sweet, and the one that we're referring to is known as diabetes mellitus, and there are two types. But let's just call it diabetes for now since we established the basis. So the issue with diabetes is that glucose is high. And in type 1 diabetes, the issue is that there is not enough insulin. Insulin is the hormone that regulates or manages the glucose in the body to keep it in the normal range. Now, in type 2 diabetes mellitus, the issue is that there is insulin, but the body is not responding to it. So glucose is also high. So the drug for today is Metformin, and it is used for type 2 diabetes, and it does three things. Number one, it inhibits or blocks an enzyme called glucose 3-phosphate dehydrogenase. That was a lot. Dehydrogenase. It is an enzyme found in the mitochondria of liver cells. When this enzyme is blocked, the liver cannot produce glucose, which is what we want. We want to decrease the production of glucose because glucose is already high. The second thing that metformin does is to inhibit glucagon. So it blocks glucagon. Glucagon is a hormone that increases glucose levels. Glucose is already high. We don't want it to be any higher. And the third thing that it does is to increase glycolysis or glycolysis, which is the breakdown of glucose. So metformin increases glucose breakdown, and it also increases glucose utilization. So more glucose is broken down and used up, so the levels of glucose is lowered. And metformin has a side effect, well, more than one side effect. So a side effect of metformin is weight loss. So if this was helpful, like, share, and stay tuned for tomorrow's drug of the day.